Good afternoon. I'm Bill Shambra, Director of Hudson Institute's Bradley Center for Philanthropy and Civic Renewal. Kristen McIntyre and I welcome you to today's panel discussion of an article published not so long ago in the Stanford Social Innovation Review, written by Paul Brest, entitled A Decade of Outcome-Oriented Philanthropy. A special welcome to our viewers watching on Ustream in the back of the room. First, our customary preview of coming attractions. Please mark your calendars for May 31, when we will discuss a new book just out from Columbia University Press by Professor Inderjit Parmar of the University of Manchester, entitled Foundations of the American Century, the Ford, Carnegie, and Rockefeller Foundations in the Rise of American Power. As the title suggests, Professor Parmar makes the case that the major American foundations are by no means innocent instruments of American compassion, but are rather self-conscious expressions of America's determination to establish and preserve its hegemony in the world. It is explicitly and proudly a Gramscian interpretation of the role of American foundation. I suspect even Pablo Eisenberg will look conservative next to this, if that's possible. To help us explore that somewhat controversial book, our panelists will include Kathleen McCarthy, Director of CUNY's Center for the Study of Philanthropy, Patricia Rosenfield, Carnegie Scholar at the Rockefeller Archive Center, and Thomas Asher of the Social Science Research Council. To be a very interesting conversation. This book, I predict, will be sort of the flagship of the revisionist left interpretation of American philanthropy. So this is going to be well worth your time. Now for today's panel. This is an opportunity for us not only to discuss a terrific article, but also to express our deep appreciation to its author, Paul Brest, who will soon step down from the presidency of the William and Flora Hewlett Foundation in California. I suspect Mr. Brest would like us to think that his legacy in the philanthropy field will rest on his contributions to the advancement of outcomes-based or strategic philanthropy, which have been substantial, reflected especially in the publication of his co-authored volume, Money Well Spent, A Strategic Plan for Smart Philanthropy. In fact, his legacy goes well beyond that. Almost uniquely among foundation presidents today, Paul sought to bring a refreshing new spirit of vigorous and probing inquiry to the workings of philanthropy. Indeed, he encouraged the sort of friendly but tough-minded intellectual jousting about philanthropy's most important issues that characterizes his former and his future field of expertise, namely the law. To give just one example, when a Hewlett staff member raised some questions in a staff meeting a couple of years ago about Mr. Brest's approach to strategic philanthropy, not only did he not try to discourage or suppress her dissent, he in fact encouraged her to publish her thoughts in the pages of the Stanford Social Innovation Review, which she did, resulting in one of the most thoughtful counterpoints to Mr. Brest's own arguments. This is really an extraordinary step for any CEO in any field, but especially in philanthropy, where, as we all know, honest and vigorous debate about basic assumptions and genuine effects is vanishingly rare. So thank you, Paul, for demonstrating that philanthropy need not fear and indeed can benefit from open and robust dialogue and disagreement about its ends and means. And of course, thank you as well for your generous support for the Bradley Center at Hudson, where we've tried as well to encourage that sort of openness to honest conversation. We will now evidence our gratitude by subjecting your article to the sort of probing and poking that your example encourages. To help us, we have a stellar panel who will speak in this order. First, Heather Peeler, Vice President of Programs at Grantmakers for Effective Organizations here in town. Then Dane Stangler, Director of Research at the Ewing, Marion Kaufman Foundation. And finally, one of the grand figures of scholarship on philanthropy.
You mean old?
No, I avoided. I would never say that, especially at my age. One of the grand figures in scholarship on philanthropy. His work 30 years ago with Barry Carl is really still the place to begin a thoughtful consideration of the role of the American foundations. Stanley Katz, currently at Princeton University. So, Paul, you can speak from there, or you can.
I'll just speak from
there.
here then.
Yeah,
and
good.
Thank you for that lovely introduction. And I reciprocate quite candidly, happily, the comment about having stimulating debate. I think that something that the Bradley Center has done under Bill's leadership is to have terrific discussions about philanthropy in the nonprofit sector. I've looked at most of the descriptions from a distance, and because I live in California, but really glad to be here today. I'm going to begin by saying what outcome-oriented philanthropy is not. First of all, it's agnostic about goals. If, for those of you in this room, if you think about the organizations you represent in the nonprofit sector or philanthropy or your own philanthropic goals, my guess is that for each person here, you can think of 3 or 4 different goals that you pursue, and outcome-oriented philanthropy has nothing essentially to say about what the goals are. They come from the donors' passions, the passions of CEOs of organizations and the like. I also think it has nothing to say, or almost nothing to say, about whether the work that is supported by philanthropy or done by the organizations that we support, whether the work is upstream or downstream. And by downstream, I mean stuff that's really quite close, say service delivery, providing homeless shelters or workforce development or teen pregnancy prevention programs, where you already have a strategy and you can actually see day by day whether it works. By upstream, I mean, for example, supporting the work of universities or think tanks, where the path to an outcome is very often indeterminate and far downstream, as it were. And I don't think that outcome-oriented philanthropy has anything to say about whether you work upstream or downstream. It depends. And I'll say a little bit more about risk as well, but I don't think it has much to do with whether you tend to be risk-taking or not risk-taking in your philanthropy. It almost doesn't have anything to do with the particular instruments of financing. Although I say almost because different instruments are more going to have more impact in different consequences. But we're for a long time, philanthropy has focused on traditional grant making, one-time or continuous gifts, but where there's nothing expected in exchange, to nonprofit organizations. We're in a period right now when there's lots of buzz about impact investing, which is the notion of getting some sort of financial return, some people hope market returns, from at the same time as you're achieving social impact. And one can be outcome-oriented either way. It's really a question of what works under what circumstances. And I think similarly, there are ongoing discussions, which I took part in early on and continued, and GEO is at the center, about the form of support that funders should give organizations, with GEO planting an important flag for the importance of general operating support. My own view is that while general operating support is golden when it works, that once again, outcome-oriented philanthropy doesn't tell you a priori whether the support should be general operating support or project support. It really depends in that case on the alignment of the funder's goals with the organizations. Finally, although I'm going to focus on philanthropy, and I expect that's what all of us are going to focus on, outcome-oriented philanthropy really has as much to do with the nonprofit sector and the nonprofit organizations as with philanthropy. That is, outcome-oriented philanthropy really means outcome-oriented work by the social or nonprofit sector. It's very hard to think of philanthropy being outcome-oriented or not independent of the organizations that we fund. Okay, so that's sort of what outcome-oriented philanthropy is and isn't in general terms, and then kind of what it actually is. It starts with goals. Outcome-oriented philanthropy, by definition, I guess, the word outcome, means that you are pursuing particular goals. You have some idea of what success would look like. And from that follows a number of of the attributes of the pieces that need to go into it. One is you have a strategy, right? If you have a goal, then you have to have some idea of how to reach that, and that's what a strategy is. There's no need for a foundation to have an overarching strategy or even a set of them. Sometimes the particular grant may have a strategy. But if there's no strategy, then one wouldn't call it outcome-oriented. And granting that strategies have to change. For lots of organizations, they're working in a situation where they have to be very adaptive. I haven't heard the argument, although maybe it'll come up today, that it's ever good not to have any strategy. There's a famous military maxim, no strategy survives the first encounter with the enemy. I believe that, but it's hard to imagine any general leading his troops into war without having at least an initial idea of what the strategy is. So strategy is one piece of outcome-oriented philanthropy. Evidence and feedback are another critical one. The more upstream you are in work, often the less good evidence there is about whether something will work. Look at the difference between testing a educational intervention that really has not been implemented or tested many places and implementing something that is well known. But in both cases, an outcome-oriented philanthropist or nonprofit wants to know what the state of the evidence is, whether it works, and if the evidence is uncertain, as it is for almost all social science interventions, indeed increasingly it seems to me many medical and science interventions, it's uncertain. You want to do your best within reason to figure out what you know and what you don't know, and to abandon strategies that look like they're not working and adopt ones that are working. And implicit in this is the essential, the role of feedback. We couldn't live our lives minute by minute without feedback, and philanthropy and nonprofit organizations cannot do very good work without it. One of the exciting things to happen during this last decade has been the significant improvement in the availability of feedback to philanthropists and the organizations they support. Randomized controlled trials, which are not the only way of evaluating things, but are a wonderful way when you can afford it, has moved from pharmaceuticals to being applied to development interventions in sub-Saharan Africa. The Poverty Action Lab at MIT is emblematic, but also a leader in this area of bringing this work. So you have the beginning of impact evaluation, not the beginning because it existed before, but you have a significant growth in those tools, and also the beginning of something which I think might be called beneficiary voice, actually looking to the people who are served by nonprofit organizations and the funders who support them about whether the beneficiaries are getting what they think they should be getting out of interventions. Basically, the question around feedback and evaluation is, how are you and your grantee going to know if you succeed? I said something about risk. I think there's heightened attention now, but we still haven't figured it out sector-wide about how to think about risk. The more downstream you are, if you're feeding mouths in a day-to-day in a homeless shelter, the risk is fairly low. Your goal is to have fewer hungry people at the end of the day, and you know whether you succeeded. If you're developing a strategy for entrepreneurship in an area that hasn't been developed, the risks are very high. Different philanthropists have different tastes for risk, but I also think that the fundamental way of thinking about this is it's worth taking high risks when the benefits are potentially very high. This is how we do our own investments, and I don't think it's different in philanthropy. We do work, the Hewlett Foundation does work in development and does work in climate, where I think the probability of success is way less than 50%. I think some of the work we're doing in trying to reduce CO2 emissions in China and India, as well as the US and Europe, the probability of success 5%, 10%. So what justifies a strategy where the likelihood of success is very small? What justifies it is that the benefit, if you succeed, is very great. And I think we're beginning to have more thought about balancing risk and return, and more thought about conscious risk taking. Especially because one of our panelists is from the Kaufman Foundation. I should mention a new and exciting and risky strategy, I think, that Stanford Business School is undertaking. It just received a $100 million grant from some local donors to develop entrepreneurship in developing countries. And if you think about what is known, the theory is that entrepreneurship supporting, and this is not social entrepreneurship in particular, it's I think mostly, although not exclusively, business entrepreneurship. The data on the relationship between entrepreneurship and either household poverty or country poverty in developing countries is very speculative. And the strategies that can be pursued through on-the-ground work or through teaching and research to reach those results are also very speculative. What I think makes the business schools venture and their funders a really valuable experiment is looking to see whether they can succeed and getting the feedback as they move along. I hope they get the feedback to learn whether in fact this is true and then how to implement it in a successful way. I've mentioned several resources that exist now at the end of the first decade of the century that had barely come into existence at the beginning. Organizations like GEO, like the Center for Effective Philanthropy, like Bridgespan and FSG to help organizations that want to become more outcome-oriented, organizations doing evaluation. Let me end by just talking about some of the barriers that still exist. I think the main barrier to outcome-oriented philanthropy is the motivation of donors. Many donors, and I will say I will include myself when I'm doing personal philanthropy, really are not all that outcome-oriented. I'm going to my 50th college reunion, and I gave and encouraged others to give because of loyalty to the college. I think that philanthropy to universities and colleges, in my case it's a liberal arts college, can be very outcome-oriented, but that's not what motivated me. I think that's fine for individual philanthropists. I'm concerned by data that suggests that even fairly large foundations, even foundations with staffs, but many large foundations in any case, act the same way I do when I'm writing my checks at the end of the year. I think there is so much potential that is lost, whatever your goals are, if you're not outcome-oriented. So one barrier is motivation. Another one is, for everyone in this room who's worked in defining goals with clarity, in defining metrics, targets that you want to achieve, in developing strategic plans, in getting assessments of impact, that's hard work. And I think a lot of people start it and they just think it's too hard. It's difficult to know what works, even when you've done that work. So many strategies, and this is a point that Bill has made over the years, so many social strategies, one is unsure whether they actually succeeded or not. And then for foundations or any donor who doesn't have a staff to support the work, it's difficult to know what organizations are doing a good job. Something that has appeared over the last 10 or so years are a number of charity rating services that are attempting to do that. I think one of the most promising is an organization which I'm not sure it has a sustainable financial model. It's called GiveWell. I don't know if any of you looked at it. It does very in-depth research into particular organizations to find out whether the strategies they are using are likely to succeed and how well the organizations are doing it. Pat, I'll end with the anecdote going back to my college reunion. So I solicited a classmate of mine, this is Swarthmore College, classmate of mine who's a philosopher at NYU, very much along the Peter Singer line of philosophers. And he said, I'm not going to give to Swarthmore because it doesn't need my money, but if you look at the GiveWell site, you will see that there's a particular malaria organization that their strategy seems to work very well and they're using their money very effectively, so I'm going to give to that instead. I couldn't disagree with that, so I said, how about this? Said, I'll give to them and you give the same amount to Swarthmore, so we have you on the giving list. So we agreed to do that, but not very many people, even when you have a service like GiveWell, and there's some others, but nothing I think quite as good, it requires some intentionality to decide to go to the site and actually see what is working there. And the motivation is not always there. I'll stop there.
Great. Well, good afternoon, everyone, and thank you, Paul, for those great comments. And there's I think, a lot of affinity between Gio's work, certainly, and outcomes-oriented philanthropy. And based on my experience in working with grant makers, I would say that most grant makers want to make a difference. That's what brings us or attracts people to the work, is to be a part of creating a positive change in communities. I think, although what's different is that grant makers will take different pathways or deploy different strategies in their effort to make a difference. And from our perspective at Geo, okay, great. And so from our perspective at Geo, we think it's important that grant makers are paying as much attention not only to their strategy, but to what they are doing to make their grantees strong and effective. You know, I'm a recovering, I guess I would say, strategy and management consultant. So I'd be the first one to say how important strategy is to success. But strategy is only part of the equation. Implementation and execution are just as important, and in some cases, perhaps maybe even more important. And so when grant makers are thinking about their strategies and the difference that they want to make in the world, again, I think it's absolutely critical that they're thinking about how they also are working to make their grantees stronger and more effective. So regardless of approach, we think that there are a number of different practices that grant makers can be taking to strengthen their grantees and nonprofit organizations. And our learning, our understanding of these practices really comes from the benefit, the privilege that we have of working with an incredible community of just about 400 or so grant makers from around the country, representing all different sizes, different types of foundations, different kinds of missions in terms of the change that they're seeking to pursue. And in our conversations with those members, as well as with many nonprofit leaders, we've come to understand or identify 4 basic practices that make a difference, that lead to results on the ground. The first is flexible grant making. So that's providing the general operating support, capacity building, multi-year grants, the kinds of support that builds that adaptive capacity of organizations, so that promising or even effective community solutions have the time and the wherewithal to really take root in communities. In addition, another practice is using evaluation for learning and continuous improvement. So certainly there's a role, and I think we would all agree in the importance of accountability and understanding what works, and the importance of having kind of rigorous evidence. But knowing that something works is only kind of one step. You have to be able to apply that information to continuously improve and make those solutions better. And so that learning process, we think, is best when grant makers are working in concert with their grantees, with their peers, and with others. Another important practice that leads to results on the ground is stakeholder engagement. When grant makers open up their doors, when they bring their grantees, the community, into their work, into their processes, grant makers in turn develop an intuitive sense of what it takes to be successful in communities. And that, we think, leads to better decision making. And then finally, collaborative problem solving we think is critical as well. When you think about the scale of the issues, the challenges that are facing communities here in the US and around the world, relative to the amount of resources that we're putting towards those challenges, go-it-alone strategies just aren't cutting it. We really need to come together, private sector, public sector, grant makers, nonprofits, to work in concert in addressing these challenges. So in listing these practices, you might be thinking, well, it's kind of common sense, these things make sense. And as Paul said, it's certainly not easy. And when you're thinking about that equation of strategy and execution, finding that right balance, I would say is almost kind of an artful exercise. There's no one right approach or way, and it's something that many grant makers, I think, are constantly trying to weigh. How do we both have clarity and be disciplined in what we're trying to achieve and how we achieve it, while at the same time being responsive to the needs of the community? How do we be relentless in our pursuit for knowledge, information, understanding, evidence, while at the same time being measured and reasonable when it comes to data requests from grantees? How do we maintain that ambition when it comes to solving and addressing critical challenges, and apply kind of an equal level of ambition to ensuring that grantees are successful? That balance, I think, is the trick that many grant makers are trying to solve. And so I just want to maybe provide a few examples of some of our members who have worked at that balance, and just to give you a sense for what that balance actually looks like. Last week I had the opportunity to visit some of our members in the Twin Cities, and so I had a chance to sit down with the staff and the trustees at the Otto Bremer Foundation. I'm not sure if folks are familiar with Otto Bremer. It's located in St. Paul, and their mission is to assist people in achieving full economic, civic, and social participation in and for the betterment of their community. So sounds like a pretty generic kind of foundation mission. They provide about $25 million a year in grants in the Twin Cities region, as well as throughout the Midwest. And they are currently going through a strategy review and trying to identify the key initiatives that they want to be kind of the center of their strategy, while at the same time they know that responsive grant making is equally important to their communities and to their work. In fact, the staff talked passionately about how important responsive grant making was to making sure that they were sourcing innovative new ideas, that they had a beat or understanding for what the community identified as problems and what solutions the community was then bringing forward. And that balance between being both very disciplined around these key strategic initiatives, while at the same time allowing for kind of a responding to what would come from the community, was something that they were really trying hard to balance. Another example is the Cricket Island Foundation. Cricket Island is a family foundation based in New York, and their mission is to develop the capacity and commitment of young people to improve their lives and communities. And Cricket Island, probably at the other end of the spectrum, invests probably about $2 million a year in nonprofit organizations. And Cricket Island has a very well-articulated theory of change, and when they think about youth development, they have very specific strategies that they're pursuing. But the way they support their grantees is through multi-year general operating grants. And one of the things that's, I think, pretty remarkable is that typically in the past their grants have been 3 to 5 years in term. And they just recently decided that their general operating support grants, they were going to extend to an 8-year term, because the board felt that it was important for their strategy, for them to provide that patient kind of support and capital, flexible resources that their grantees really needed, again, to be successful. So these are just a few examples, and I'm sure here in the room among some of the grant makers here, we'd come up with some others. And then certainly from the GEO membership, there's tons of examples of the ways in which grant makers are balancing the strategy and the execution. So that said, despite what we know about what works in terms of strengthening nonprofit organizations, we still, as a field, are not making enough progress. Recently, GEO conducted a field study. Every 3 years, we survey the field to understand what are the behaviors or the practices that grant makers are doing that lead to stronger nonprofit organizations. And what we found between 2008 and 2011 was that it's the same level of dollars going into general operating support. It's the same level of support for capacity building. We really haven't made much progress there. If there is a silver lining, the paperwork burden has been reduced for grantees, and I think that's probably something many of us will cheer about. And if you're a glass half full kind of person, you might argue that in light of the recession, the fact that we didn't see a decline in general operating support or capacity building, that perhaps that's a small victory in and of itself. But when we looked at the data, about a quarter of the respondents did make improvements for the better. About a quarter of the respondents increased their level of general operating grants, increased the amount that they were investing in capacity building. And when we looked behind the data to see, well, what's happening, what's taking place there, we found that those grant makers are the ones that have systematic or formalized processes for engaging their grantees and nonprofit organizations. So that when grant makers have that ear to the ground, when they know what's happening in the communities, when they understand the needs of the grantees, they are more likely to take on the kinds of behaviors that lead to stronger nonprofits. So the bottom line, regardless of whether or not you consider yourself to be an outcomes-oriented grant maker or not, every foundation can take steps to boost effectiveness. And I think the good news is that modest changes or adjustments to practice can really lead to big impact for nonprofits. And it starts by constantly asking, what is it that we can do as grant makers to ensure that those that we work with, those who are creating the conditions for change in communities, those who are advocating to lawmakers, policymakers, those who are delivering those critical services, what can we do as grant makers to ensure that they are successful as possible? Thank you.
Is this good? Hear me? Well, first, thanks to Bill and to the Bradley Center for organizing this panel and for inviting the Kauffman Foundation to participate. And thank you to Paul for not only writing the article, but, as Bill said, subjecting it to some probing and prodding. Quickly on Paul's point about entrepreneurship in developing countries, you're absolutely right that, and one of my former colleagues, Tim Kaine, is in the audience, and Tim can correct me if I'm wrong, but I think you're right that in the literature, at least, the relationship between entrepreneurship in developing countries and per capita income and household income has indeed been speculative. But to your point, I think it's in large part because we've been measuring it really badly and really not defining it properly. So hopefully, the Stanford initiative is a way to improve on that. I had the opportunity this morning to attend the Atlantic Magazine's Healthcare Forum that they hold every year. It's their 4th annual, and there was a panel on healthcare, the Affordable Care Act and its fate, and there was a big debate on the panel over quality care. And we had 2 physicians up on the panel, and they were talking about quality of care. And finally, one of the other panelists said, there's no physician in the country who wakes up in the morning and says, I'm going to deliver substandard care today. Quality is every physician's goal. And so I agree with Paul and the rest of the field that yes, outcomes are important. It's very hard to disagree with that, but to his point and to Heather's comments, if there is any disagreement, the disagreement is on how to get there and how we define those outcomes. On a more minor point, I think Heather's correct and Paul's correct that foundations have been far too unwilling to provide general operating support. And not only that, but to Paul's point, even if that is an inappropriate strategy for your outcome, too willing to sort of write it off irrespective of your goals, to not even consider it as a strategy. So I think that opening back up that debate, which Paul's article hopefully will be a good thing. I sort of wanted to just focus my comments on some very general observations about not just outcome-oriented or strategic philanthropy, but sort of the whole movement within philanthropy over the last 10 years, and there's sort of been a lot of things moving in this direction. As Paul noted, you've had proposals, for more self-governance in the field, more government regulation, nothing to be done, more transparency, more accountability. So there's been a lot going on, as I assume most people in the room are familiar with that, and Bill has organized some panels here focusing on a lot of those debates. At the risk of maybe stepping over into Dr. Katz's territory, he being the historian, the official historian, I think it might help to to step back and set some context. And as far as I can tell, I think that outcome-oriented philanthropy or strategic philanthropy might represent, or probably represents, sort of the tail end of this 30 or 40 year evolution in philanthropy that really was instigated by the 1969 Tax Reform Act. And most of you are probably familiar with Peter Frumkin, who's a scholar of philanthropy. He's moved to a different university now, but Peter has written a lot on what he calls the long recoil of foundations and philanthropy from the Tax Reform Act and the vast changes over time, not all immediate, but over time, over 30 or 40 years, that those changes in the tax code provoked inside philanthropy. And Peter especially has focused on how it led philanthropy and it led foundations to become more process-oriented, more administrative, more professionalized, which cuts both ways, but overall more bureaucratic, and as a consequence on the substance side, perhaps bringing in greater timidity to the field. And I think that outcome-oriented philanthropy and everything that goes on under that rubric probably represents sort of an attempt to, a recognition that the pendulum has swung too far in that direction, granting Peter's thesis, has swung too far in that direction. We need to break out of sort of that 40-year paradigm, which is an entirely good thing. I think it still keeps one foot firmly planted in that world of process and procedure, which again cuts both ways. But I think there's sort of three characteristics of that approach, and I don't just mean Paul's article, but sort of a lot of the stuff that's gone on over the last few years under these labels. There's sort of three characteristics that sort of jump out at me as landmines wouldn't be the right word, but potential limitations of some of the new things we're talking about. One of them would be, humans have this tendency that gets magnified in philanthropy, and especially in foundations, this tendency to vastly overestimate our ability to sort out cause and effect relationships, to properly attribute causation, and even to define outcomes properly. One of the other debates at this healthcare forum, and healthcare, as we all know, is just rife with these kind of debates, was, okay, I'll grant you that quality is everyone's goal, but what does that mean? They can't even come to an agreement on what quality care means, and even what health means. There was an entire presentation that we don't agree on what health means. So how can we even get to a debate about healthcare, fixing the healthcare system? We don't agree on the outcome. There's two books, I almost brought them as props, that have been published in the last few years that I think, while they may not even mention philanthropy, I think one of them maybe does, but I think should probably become really standard reading in the field. One of them is John Kay's book, Obliquity, which is sort of, I don't think he mentions Michael Porter, but it's almost an anti-Michael Porter tract on strategic planning, sort of the fad that has swept business and the nonprofit sector and the government sector for the last 30 years. And it's a terrific, pithy read. And the other book, which is a little bit denser but is terrific, is Catherine Schulz's book, Being Wrong. I think that should probably be on the desk of everyone in philanthropy, everyone in any sector of the economy, but especially in philanthropy and the nonprofit sector. There's been a lot of good work in behavioral science and behavioral economics, but I think we still overestimate our ability to define these things and to identify the causes and the effects and the outcomes. The second thing, more general comment, is a lot of the recent talk in philanthropy and the nonprofit sector has been about problem solving and systems thinking and approaching things as complex systems. This is a good recognition that a lot of the challenges and a lot of the issues we're facing are interconnected. Healthcare, again, is a perfect example. These are interconnected. There's all sorts of just complex relationships. I think it's a challenge in the sense that I'm not sure that you really solve in any definitive sense an issue like education or poverty or healthcare. There's not sort of a defined endpoint, and it's very much a 2 steps forward, 1 step backward kind of approach, where every set of successes that we have opens up a new set of challenges, and that's definitely not a nihilistic view that, well, we should just throw our hands up and do nothing, but it's a sense that we should recognize that there are these complex feedback loops, and the goalposts, the outcomes are constantly shifting. And so to Paul's point, I think you would probably agree that this underscores the importance of evidence and feedback. And to some the points in the books I mentioned, we're going to have to revise our outcomes and revise what's possible, and are we even targeting the right causes and the right effects? And that sort of underscores this sub point about the importance of language in philanthropy. We have an incredible tendency to adopt things from the business world, to adopt things from the government world, and use very slippery language. And I think one of those is risk-taking. And Paul talked about this a bit, and I think we can too easily confuse, and I'm speaking about this purely from a foundation perspective, so I'm excluding the grantees and the nonprofits here, but I think we easily confuse risk-taking and a high or low risk with the probability of success. If Kaufman or if Hewlett gives a grant or launches a grant program, there's almost no risk to the foundation. Nothing happens to us if it doesn't succeed. We live an incredibly cocooned existence, and so we need to be careful with the language that we use to describe our actions. The last point. I think it's entirely good, and Paul's done service not only in his article, the article under debate, but in his long career and also in his career in the law, to get to precision and clarity and specificity and outcomes is a good thing, and that can sort of counteract a lot of the more slippery linguistic problems we face, that have some precision. But it's also important to step back and re-examine or examine the starting presumptions and the assumptions that we operate under. And one of the ones that has sort of, it's not even implicit, that has explicitly underwritten this movement on outcome-oriented philanthropy or strategic philanthropy, or any of its related cousins, is that philanthropy as a whole, as an entire sector, is underperforming, and that the chief culprit of that underperformance is, a lack of a clear external accountability mechanism. I am very broadly sympathetic with those views, and in a forthcoming essay, I discuss this as much. But it's also important, even though I hold those views and I'm sympathetic to it, I think it's important to challenge them. As to the latter, it's true, and this has been a debate in philanthropy for a number of years, it's true that businesses have shareholders and that government has voters and constituents, and that there are at least clear lines of accountability in those sectors. It's certainly not true that those have been a bar to underperformance in those sectors. I don't think anyone would say that business and government are overperforming, at least as a whole, and especially here in Washington. And I think it's also true, and the reverse is also true. We can point to lots of examples over the last 10 years, 30 years, 100 years, and Dr. Katz has done a good job highlighting those, of high achievement or overperformance in philanthropy. Joel Fleischman wrote an entire book and a case book filled with all these examples of high achievement. And I think if we look at those, when we find a grantee and a foundation working together, when we look at an individual donor philanthropist, in those instances of high achievement, overperformance, whatever you want to call it, we find often that they're operating out there on the frontier. It's the frontier of ideas, of imagination, of creativity, however you want to describe it. And by definition, when you're operating out on the frontier, you don't have, and you don't want to have, external cues or reference points. If you're trying to do something new and you're going to measure yourself by existing or old standards, you're not going to get to do something new. You have to create those reference points. And we talk a lot about this at the foundation, in part because we study entrepreneurs and we fund lots of entrepreneurs. And that's how, and we sort of look at them. And this was the charge from our donor, was to operate as an entrepreneurial foundation, which You don't have to point it out to me. It's already been pointed out to me by several people that that is possibly an ontological impossibility to have entrepreneurial philanthropy. But nonetheless, we try to. And when we look at entrepreneurs, the kind who are seeking to do big things, and they're not always going to succeed. But even when they fail, they're self-referencing. They're trying to measure themselves by their own standards. And so I worry about, and it might be a hollow worry, but I worry that a convergence toward standards and best practices will ironically sort of obscure the outcome that I think we would all share, which is a more high-performing, more high-achieving philanthropic sector as a whole.
Thanks very much. I feel a bit like a fossil here, but I'll try to go on. Anyway, I did want to thank first Bill for the invitation to come here and to express my admiration for what you and the Bradley Center have been doing here. This is the most open and best forum on philanthropy I know about, and we're all grateful to you for doing that. And then, of course, to thank Paul. Paul and I have now, in the course of his career at Hewlett, several times engaged in discussions of this exact subject, and it's always been fun to do that. And I have to say that there isn't any foundation president I admire more. He's done a wonderful job, and I very much regret, actually, that he's going back to law teaching at this point. But I have a hunch he's not going to lose his interest in philanthropy. So we'll look forward to what he has to say from here on in. I'm not going to criticize Paul's piece, both because I don't have much to criticize in it, but also he makes it very hard to criticize it because he is so generous, and he's become so much more open, I think, on this question over 10 years, that he's covered himself on almost all the points at which we earlier disagreed more vigorously. He begins by saying that, of course...
I've learned, Stan. I've learned from you.
He begins by saying the point at which we initially disagreed, that, of course, for the last century, philanthropy has always been outcome-oriented, and which was my point some years ago when we first discussed this in public, although we still might not agree on particular accomplishments or lack of accomplishments by foundations. But it is a generous piece, and I think is an extremely thoughtful piece. And so Paul's views and the idea of strategic philanthropy certainly don't bother me at all, although I think that some formulations of the complex of ideas that Paul's talking about are extremely problematic and are causing very serious problems in the field. I think what I had originally planned to say doesn't fit anymore, having heard what has been said to you already, so I'll switch gears a little bit. And I want to say that I agree entirely with what Dane just said. This strikes me as an extremely useful way to think about this particular set of problems. So let me make a few very general comments. The most general one would be this. I don't agree at all with Peter Frumkin, and we can talk about that another time. I think, obviously, the Tax Reform Act of 1969 was an important moment in the history of foundation philanthropy. There certainly were some significant changes in performance. But apart from the caricatures of foundation performance at that time, attacks on Mac Bundy that were more personal, I think, than anything else, I don't think, in fact, very much has changed in terms of the way large foundations think about what they do and the ways in which, I mean, after all, the brute fact of law and of philanthropy in this country is that it doesn't much matter. And you mentioned accountability. You know, we have almost no mechanisms, legal mechanisms for accountability in the field. It would be a very different field if we did. I challenge people in my own classes by saying that I think that in American law, in effect, philanthropists can do anything that is not criminal. And I'm prepared, by the way, to defend that proposition as a matter of law. And no other country that I'm aware of has such a broad legal definition of philanthropy. So it gives those people of means, institutions of means in our society, tremendous running room. And so from that point of view, I think Peter's formulation for me is much too narrow. What I think is much more important and hasn't really come up today at all is Dane mentioned that the goalposts are changing. Well, it's not only that the goalposts are changing, they are, but the field is changing. And the context for philanthropy I've been studying the field now since the early 1970s, so that's a long time. And the United States has changed so incredibly over that period of time that has had a tremendous impact on the field we're studying, because it's not an independent field. It is part of a context in which government, business, civil society interact, and the relations among, at the very least, those three factors have changed so profoundly. So if you go back, for instance, to the beginning of that period, I wouldn't go to 69, I'd go to 65. I mean, you start with the Great Society, and think about what Great Society patterns of government and economic behavior had to say about how civil society in this country developed. And if you move ahead not so many years to the late 70s, or certainly to the early 80s, and you see the profound conservative reaction against exactly those kinds of ideas, behaviors, institutions, we begin to develop a whole new set of practices and institutions in response to them, among them conservative philanthropy itself, which is largely a function of the 1970s. You move on into the 1990s, you get the sorts of reforms that we saw under the Clinton administration, which move us slightly, I would say, back in the original direction, but only slightly. And then we move on to the period we're in now. At the same time, one other thing that's changing, which we haven't remarked, is the growth both of civil society organizations and, more significantly, I would say, grant-making organizations. So, we've spoken about grant-making organizations as though they're generic. Well, they're not. There's a tremendous range of organizations. Look only at the size of the sector. I didn't bother to look up the numbers, but if you look at the number of 501c3s in, say, 1970, and the number in 2010, a tremendous, not only a tremendous enlargement in the number, but in the scope of those institutions, in the ways they behave. And of course, exactly the same thing is true for grant makers. Is not only there are so many more grant makers, but they're grant makers of a scale we never saw before. I mean, forget Gates for the moment, because there's philanthropy and there's Gates. It's of a scale that simply is different than everybody else. But if you eliminate Gates and look at everybody else, even so, take the largest 50 foundations as of last year, compare them to the largest 50 foundations in 1970. Go do that sometime and take a look at what that list looks like. You won't they are two different foundation sectors. So it's not surprising to me that we think about foundations and we think about grant making differently, depending upon where in that food chain you happen to be. So I don't think it's very helpful to speak about the sector as a whole. I think you really have to disaggregate. Let me make then just a couple of, but that's the historical point. And by the way, what comes along with all that, of course, is the profound change in the way the state, particularly the federal state, relates to the welfare system in this country. When we start, as I say, in this my little narrative, from the Great Society, in which we in this country begin to move toward the welfare state in a realistic way, in a manner in which we hadn't at any time before. We then begin to try to disassemble that in the 1980s, and we do, mainly to the extent that we change patterns of federal funding of civil society. We move from block grants and direct government support of these organizations to the indirect support that we have now, that is, payments from the state through individuals, through food stamps, through other kinds of transfers through individuals. That's an environment we're still in now. And all the time, civil society is scrambling to keep up with these kinds of political, economic changes at the top. That's the context to me that matters. And until we think about what we're interested in, philanthropy, civil society, and put it in that broad political, economic context, I don't think we can get very far. I want to change course here and just really comment on two other things. One is what worries me in the kinds of developments that Paul is talking about is not the overall pattern, it's not outcome orientation, it's some of the process conclusions, it seems to me, that come from that. And let me just mention a couple of them. One is the idea that Paul mentions in the piece, although I don't think he did here, scalability. How important, should we prefer innovations that are scalable? I can understand from certain kinds of organizational points of view why that's important, but I think it's not always important. And one of the qualitative judgments, and that's what concerned me mainly, that have to be made is, when does it matter? When is it worth privileging scalability? The other one that we haven't talked about here is time. What's the longitudinal dimension of what we do? Paul has referred to that by saying upstream and downstream. I think that's an inelegant way to talk about what I'm talking about, but we know what we are talking about. And it makes a big difference, and there's been a huge change in philanthropy, because philanthropy has changed from the longue durée to tomorrow, at least too often. And here I'm making a very general statement, I realize. But we are privileging what happens in the short term to an increasing extent. That's because of the burden we increasingly put on ourselves to make it a better world as quickly as possible. One can understand why that is. But a point that I've been trying to make for a number of years, and Barry Carl did with me, is that in doing that, we lose something. The longue durée has a lot to be said for it, and I think particularly in philanthropy. Finally, I just want to comment on the notion of evidence. It's like who's against effectiveness or who's against good outcomes. We're all in favor of both of those things. Well, who is against evidence-based decisions? This is a mantra now. I find it one of the most upsetting mantras around because, again, nobody other than an idiot is oblivious to the evidence. Nobody wants to ignore the evidence. But Dane actually said, I think, it's not always so clear what the evidence is on the one hand or how to understand it on the other. And frequently we don't have adequate evidence. Does that mean that we should take a hands-off attitude where we don't have such evidence? And my response to that would be not always. And it's that more than risk that concerns me in all of this. And finally, what goes along with that, and I think both Paul and Dane mentioned this, I think the ghost in the closet here is social science. It's usually not mentioned, although Dane certainly referred to it, Paul does all the time. We can't do good philanthropy without good social science. If we're going to understand what the evidence is, if we're going to interpret the evidence, we need better social science than we have now, and yet the fact of the matter is, at least in the elite institutions, social science is headed exactly in the wrong way. Some of you will recall that Paul Krugman wrote a piece on what's wrong with economics, I think 3 summers ago in the New York Times magazine. He said the economists have gone wrong because they've given up truth for beauty. I think that's exactly right. It's increasingly true of political science. Sociology, I would say for the moment, is doing better. But at the moment, in the great universities in this country, you can no longer get tenure by doing good empirically based policy research. The prizes all go to people who do much more abstract, theoretical, model building kinds of work. That's very interesting. And I admire the people who do it well, but they're not going to save the world. And what we need is to go back to what, in fact, some of the earliest philanthropists did, particularly at the Rockefeller Foundation, the Spellman Fund, early in the 20th century, was to build social science in order to save the world. And I think that's what we need to do. Thank you.
That's, as Professor Katz suggests, his early work with Barry Carl was very much focused on the centrality of the first big American foundations to the formation of social science in America, which is why you've suggested and others of us have suggested the notion that outcomes-based philanthropy is a new thing is, of course, not at all the case, because it was at its birth in this early institutional expression, it was all about outcomes. It was all about transcending mere charity, right, and getting to results through an understanding of social science. Paul, I wonder if you could you speak, and Dane mentioned it, Heather mentioned it as well, this notion of, at least GEO has, has an understanding of results that proceeds from working with their grantees, relying on their own power. How do what is the answer to this question of the elusiveness of understanding impact, the elusiveness of results? As everyone has said, of course we're interested in outcomes, but how are we going to understand those outcomes in anything other than a kind of a very pedestrian way? In other words, units delivered, of course, that's easy, but the larger vision of philanthropy, which allegedly philanthropy has the freedom to pursue, how do you do that, and how is that measurable in any serious way? And also feel free, please, to respond, of course, to any comments that you heard from our
Well, let me start there. And again, the hope is that we're going to broaden this conversation to everybody here soon. But I want to argue. I think, in some sense, it's ultimately much philanthropy is about units delivered, and that's okay. And some of it's not, and that's okay. But it begins with clarity about goals, and the reason for clarity about goals is that otherwise you can't decide whether you're being effective. I mean, implicit in being an effective organization is being effective toward some purpose. And again, the goals may be multiple, and some of them, I think Stan is right, upstream may be inelegant, especially if you think of what people sometimes do upstream that affects downstream. But it's not just a matter of time. Sometimes it's a matter of supporting organizations. Supporting the Poverty Action Lab is not just a matter of time. It's supporting something that has lots of different potential for lots of different results. But a lot of the issue is time. But clarity about goals, even if the goals change as you implement, at any given time, you need to have some goals. And I actually, I was looking for fights to pick, because the goal is not to agree, for us to agree, but to look for argument. And I think that it would be a mistake to think of health as the goal, or quality of health as a goal. As soon as you get into the weeds, and I expect Dane has done this, you can't, if you talk health as a goal is like human betterment, you then have to say, well, whose health under what circumstances? If you're talking about a particular disease, what's your goal for improving diabetes over 10 years? It's not health in general. And I don't believe that anybody at your conference thought that quality was the only goal. I mean, you only have to participate in any of the U.S. debates over the last 5 years or so before that to understand that we're looking for quality. We're also looking for cost effectiveness. I was talking to somebody who is doing investments in bottom of the pyramid cataract surgery in India. Their ability to serve many people at a low price requires having a lower quality of care than is in the U.S. In the U.S., there's a quality of what your vision is going to be afterwards. Cataract surgery in India assumes that people have to wear glasses, and yet it's able to do that. So you have to get into being fairly precise, especially in the health area about goals. I completely agree with Dane's point, and I think Stan made the same point about social sciences are notoriously, and I think even with good work of things like the Poverty Action Lab, we're never going to know for sure what works. And even if we know that something works, even if deworming strategy works in Kenya or one part of Kenya, we can't be sure how the same strategy will work in a different country, different place. External validity goes from science to a great deal of craft. And a huge amount of decision-making we all make in our lives, and philanthropy has to make, is decision-making in conditions of uncertainty. That's what's really interesting, decision-making. That's the course, I teach a course on this, not in law, actually, but in the law school. But at any given time, you have to make a decision based on what you know, being modest about what you don't know. And that has lots of implications, one of which is spending resources to figure out what you don't know in order to make better decisions in the future. But it's not an argument for not doing anything based on social science. It's an argument for making the best bet, and in case you think you may be drastically wrong, hedging the bets in some ways.
But Professor Katz, your point then comes in, I think, and that is that social science, at least as practiced in the universities, seems to be less and less relevant to the kind of decision making that Paul is.
Well, I mean, that's my concern.
Yeah.
That, it's not necessarily true everywhere, but increasingly in the elite universities, the way academic rewards are structured right now, the incentives for doing the kind of work that we're talking about are fewer and fewer, and that worries me because I think we need to find ways of getting the best young, the social scientists of the future to be worried about social problems and about the application of social science to the solution of real world problems, and which is where it started, but we've come a long way from that.
Right. And just one last thing, Paul, if you could say something about Heather's point, that grant making needs to take its bearings from the stakeholders, from the folks who are actually executing the programs. I understand that isn't your, but that isn't your belief necessarily. But when you begin to do that, and then again the question of replicability comes in here. When you do that, don't you end up with a great variety of different approaches in such a way that it almost becomes impossible to speak comparatively about what's working in across larger areas, right?
I completely agree with Heather, and I don't know why it makes it difficult. That is, it begins with the grant maker's goals. So as soon as you have goals, you have selected a very small number of the possible of grantees in the world. If you're interested in curing cancer, then my guess is that there are few people in this room who are potential grantees and others are not. And if you're interested in curing cancer, then you can think, this is not an area of work. I'm not sure I use that example, but I'll follow it. There are a limited number of strategies. You may support research, or you may support advocacy to cut down on smoking or cut down on other causes of cancer. And again, that's a decision like that may be made based on effectiveness. It may be path dependent. A foundation that already has medical expertise is more likely to choose the medical route, although Robert Wood Johnson moved out into advocacy. But it starts with your goals, and at that point, it becomes a conversation with your grantees. Top down, it doesn't even have to do with respect. It has to do with being effective. If you're top down, it's not going to work if you don't have conversation with the grantees and if you don't get grantee feedback. So I actually completely agree with Heather. I think one of the phenomena of the last 10 years that has been very good for those foundations that have been willing to use it is the Center for Effective Philanthropy's Grantee Perception Report, which gives anonymous feedback to foundations of how their grantees are perceiving them and what a royal pain we are or not in working with them.
But Bill, can I comment on just
please.
To give Paul and Heather maybe a tagline? My favorite all-purpose quotation, which I bequeath to everyone, is from Aristotle, and it's, everything that is necessary upon some hypothesis. And it seems to me that's exactly what you're saying. And Aristotle's always good.
Right, yes, very true. Anyone else want to just jump in before we proceed to questions from the audience? No? Good, all right. Let's have some questions from the audience. We haven't called on Martin for a while. Why don't we have Martin Worcester, Martin has an op-ed in the latest issue of Chronicle of Philanthropy, for those of you who... Go ahead, Martin.
Oh, it was
Martin
published?
Worcester.
Hi, I wrote a book called Great Philanthropic Mistakes. You might say it was a critique of outcome-based philanthropy.
Speak directly into the microphone.
Yeah, I have two classes of grantees that I wonder if outcome-based philanthropy works. Does it work in the arts? I mean, you can say we funded X number of operas or 20,000 people went to our concerts, But if you're, say, someone who is trying to support a particular kind of art, say romantic or traditional sculpture or paintings, it doesn't seem to me that outcome-based philanthropy gives you enough information to judge whether or not your grant was useful. You can say the sculptor made X pieces with my grant, but it doesn't tell you whether the pieces were great art or he was the second Thomas Kincaid. The other thing is in poverty fighting, for grants that are based on sort of spiritual methods, like say you're a Christian poverty fighter who wants to give money to make sure that poor people come to your shelter and learn biblical skills to become able to enter the workforce. You can say, we serve 20,000 people in our shelter, we fed X number of meals, but it just seems to me there are valid philanthropic goals that you can't really measure with outcome-based philanthropy.
So since we have a performing arts program at the Hewlett Foundation, which supports music, theater, and dance in the Bay Area, and since it has gone through an outcome-oriented strategic planning process, let me just describe some of the things we care about. It's not how large it is, how large the audience is. It really thinks about, and I can't remember if this is on our website, but I'm happy to send it to anybody who's interested. We think in terms of the entire ecosystem of philanthropy. So we support some small, edgy performance groups, which if they get 20 people, they're lucky. And we also support the symphony. We also care, but one important outcome is serving community. So we care about who comes, and because we care about the Bay Area as a whole, we care not only about San Francisco, but about surrounding areas and supporting those communities. And we care a lot about quality, not just the number of things. We don't commission works, but we do support performances. We care about quality. And my guess is everybody here who goes to or sees the art forms of their choice cares about quality. That's what reviewers are for. And that's an example where there may be a lot of diversity in views about what something works. But on the whole, we think that we have a reasonably good take on, in the art forms we support, what's really crappy and what's really good and exciting. I can't speak on the spiritual methods of entering the workforce. What I can say is I'm skeptical whether one can measure whether somebody has become a more spiritual or more religious person. You can test whether this particular program is getting people into the workforce.
Can I disagree with Paul strongly on the arts? And apart from the kind of program that Hewlett runs or MacArthur in Chicago, Pew in Philadelphia, many of the great foundations support the arts in their locality, I think primarily because of the potential of the arts for community building and their sense of responsibility to their own community. But I think there are also great examples of big arts programs that have pretty clearly been effective. And my hero in all of this would be McNeil Lowry at the Ford Foundation, who over a long period of time managed the first large foundation arts program and succeeded in doing a lot in terms of building infrastructure for arts organizations. He had a very clear vision of how philanthropic was a strategy, how philanthropic funds could be applied to build an entire field, or what the Wallace Foundation does in terms of audience building as a technique itself. So I think there are a lot of good examples of that.
Okay. Let me just right in the back here. Yes, good. And please speak directly into the microphone. Hold it very close to your mouth, uncomfortably close to your mouth. And name and institutional affiliation.
Sure. My name is Jeff Raderstrong. I'm at Venture Philanthropy Partners. I have a pretty broad question. I think a lot of you were kind of about to touch on this, and I was hoping you would, and then kind of moved away from it. But You know, all of this is from the perspective of a grant maker, kind of, which makes sense. That's what we're talking about, grant making. But I think it's important to look at outcomes for society as a whole. And, Paul, you started by talking about how this was all sort of agnostic towards goals, but it's really about those results. And so for me, this whole conversation is a little bit limiting because we're not talking about, is society better off as a whole? So how do you get at that? I mean, I know it's a big question, but it just seems like if we don't start thinking about that, then what is this conversation going on for?
Well, let me take a first crack at this, and I hope others on the panel will respond. Any different philanthropists have different views about what makes society better off as a whole. And I think the best way of making that clear is there are philanthropists who support choice, and there are philanthropists who support anti-abortion. There are philanthropists who support gun control and philanthropists who support the right to carry guns. Each of those has different views about what makes society better off. To come back to the earlier discussion of accountability, one of the things that I think is wonderful about the non-accountability of the nonprofit sector and of philanthropy, other than not engaging in criminal activity, I would add for foundations, not engaging in lobbying, which can get you in pretty serious trouble. But other than that, I think the non-accountability is what allows for multiple versions of what makes society better off as a whole. And I think the U.S. is probably unique in encouraging those multiple versions.
I mean, I would support that. I think the challenge is, society better off as a whole. I mean, that's almost too big, and almost too big for any one foundation to influence. And I think when grant makers are thinking about, they have limited dollars, and and thinking about their own effectiveness, and where to invest those dollars and the choices that they're making. To Paul's earlier point, you have to be a little bit more narrow and specific in terms of what any one individual is trying to achieve. And I would say that from the perspective of accountability, I think it's the grant maker's own individual accountability of him or herself that matters first. I mean, certainly there's an accountability to the public in the sense that these activities are subsidized in many respects through taxpayers. So there's certainly an accountability there, an accountability to the community. But there's the foundation's mission, and that's what I think has to be kind of the driving point around accountability, and having goals that are clearly defined and discrete enough so that you can gauge whether or not you're making progress. I think that's what's critical. So collectively, perhaps that adds up to broader societal change, but I think for any one individual foundation or philanthropist, they have to take maybe a smaller step.
Just use the first part of your question as a jumping off point, that this is mostly from the grant maker's perspective, because I think it highlights, and sort of underneath your question, highlights how foundations and philanthropists define their outcomes in the first place, and then how we sort of revise them. We do a lot of work in education, and over half the foundation is involved in education, and most of that's in Kansas City, and we've had a program for a number of years. And Kansas City, like most metro areas, has terrible urban schools, and so we've done a lot of work on extracurricular outside school programs, and we've run one called Kaufman Scholars for a number of years, going on 10 years. The outcome that we specified at the beginning, and dating back to some earlier programs too, was college graduation. Horrible record in Kansas City schools, as with lots of other urban school districts. And so we've, dutifully poured lots of money into it, run lots of programs, had, lots of studies, brought in outside research firm to study it, lots of stuff. And, prior to that, to getting to that outcome, that's a good outcome, right? I mean, it's good for the economy, it's good for society, it's good for those kids. So it turns out that it's not a universally good outcome, and it's not actually what was wanted, by everyone in the community. And, we had done all the research, had defined this as a good outcome, and, talked with parents and students and community leaders, and And maybe at the beginning it was because there was such a terrible record, but that is as it went on, and I mean, 10 years, that's a lifetime in terms of how the economy's changing too. We're revising that outcome and making it more, whatever you want to call it, multifaceted, different. Maybe it's preparing them for, economic success. Maybe that's a better one because it encompasses a larger range of outcomes. So I think that highlights your point that, foundations and philanthropists or grant makers writ large, we also have this tendency, right, to sort of appoint ourselves as outcome determiners and sort of without regard to a lot. And we can do all the research we want because the literature clearly says college graduation is a good thing, even though it may not always be. And that doesn't mean that kids shouldn't graduate to college. It means that another route to success.
Well, I'll just comment briefly that I think the most interesting way to think about that question is comparatively, because I think it is, as I think Dane said, what's so distinctive in this country is the size of the philanthropic sector, the size of the civil society sector. And I think we in the United States could learn a lot by comparing what we do with the way other countries, other cultures approach exactly the same kind of problem. It's, we brag, as Paul just did, and I would agree, about the diversity of our sector. But it begs the larger question that I mentioned of political economy, of how is civil society situated vis-a-vis both the state and the market. That's what's contested in our country.
One way of getting at this, Pablo Eisenberg had an op-ed in the Chronicle of Philanthropy not too long ago, in his usual understated fashion, raised some questions about a and I can't remember all the details. He can, if he wishes, he can supply them. But raised the question about a foundation's goals and purposes, and suggested that they were not adequate given the resources, given the needs of society. And an awful lot of the response, and it generated quite a bit of response on the website, an awful lot of the response was, who are you to say what this wonderful fortune should be devoted to? It's none of your business. He made the money the way, and he should therefore be able to spend it however he wishes and without criticism. Without people like Pablo saying, society has a larger need that needs to be addressed. Is there some tendency? I mean, there is this sort of absolute respect for donor intent, which of course is a very important thing, because otherwise people wouldn't enter the field in the first place. But is our discourse on philanthropy constricted by this reluctance to criticize wealthy people for doing whatever the heck they want with their money? Is that a problem, Paul?
Well, I mean, why should somebody be immune from criticism just because they're rich and spending money? I mean, of course people should criticize. And I mean, I've a lot of my writing criticizes means, but it seems to me that it's completely legitimate to criticize goals. When it turns out that that Leona Helmsley didn't only leave money for Katz, but it seemed to me perfectly appropriate for people to wonder, more than wonder, to think that leaving a large fortune to your Katz was, a deeply inappropriate thing to do, granted all the diversity of philanthropy.
Donors get a tax benefit. I mean, in exchange, there's the expectation that they're in exchange for that tax benefit, they are going to do something that is for the betterment of community. And so I think it's appropriate for community and others to question, and for grant makers and philanthropists to be able to defend what they're doing. If they don't want that type of scrutiny, then they should give out their money through other means or mechanisms.
Give it to their children.
Yes.
We had a panel, incidentally, on the Leona Helms. Is philanthropy going to the dogs? That's the title. It wasn't cats, it was her dogs.
Sorry.
Speaking of Pablo, here's Pablo.
Yeah, I don't want to comment on that op-ed, but I do want to raise a question about what is probably the most elite institutions in the country, namely foundations, composed almost entirely of wealthy and highly paid professional people. And the question is, what impact does that have on both outcomes and effectiveness? And were that to be changed, somehow if boards were to be democratized, would that change the outcomes and effectiveness in your view?
I think that if boards were democratized, the foundations were truly representative of the country or their local populations, that goals would be very different. I think we would have more funds going to different things. I wouldn't want to predict what they are. I would hope it would not. I hope it would not decrease effectiveness. And the argument that I make in this piece and others is that effectiveness in the core ways that we've been describing them apply to any outcomes at all. It's not that you have different approaches to effectiveness in terms of having goals and strategies and evaluation for community-based work than you do for cancer research, than you do for entrepreneurship in developing countries. But I have no doubt that it would affect the goals.
You know, Pablo and I actually discussed this not too long ago, but what's interesting to me is that there was a time about 30 years ago, in fact, where there was a lot of public discussion about making legal requirements for public representation on foundation and other boards, but let's say just foundation boards. And I agree entirely. I think it would make a real difference if the Gates Foundation was required to have one or more public representatives on it, and likewise with every other foundation. But as far as I can tell, that discussion has gone away. What has happened, though, and if you look back again over the last 40 years or so, the foundations themselves have felt an obligation to become, I would say, more representative than they used to be. Like when Barry and I first wrote the early chapters of all this, all trustees of foundations were white male Protestants who more or less went to Amherst or Harvard or Yale. It was a pretty narrow set of people. And it wasn't really until the post-World War II period, I think it's right that, at least among the major foundations, no woman ever sat on the board of a major foundation until after World War II. And then other kinds of Americans began to be appointed to those boards. So there has been a very significant increase in the representativeness of many of those boards. And I think if you look at what the foundations have done since then, it has made a difference.
I'd like to address that as
please.
well. I think both in the social sector as well as in the private sector, there is a movement or interest around empathy and the role of empathy in driving performance. And we partnered at GEO with a research firm, Jump Associates, or a strategy firm, looking at those organizations, both in the private sector as well as in philanthropy, that have widespread empathy and what that leads to in terms of results on the ground. And so we define widespread empathy as having that intuitive sense of what your customers or your constituents' needs and wants and desires are. And when that is integrated throughout the organization, again, you can make better decisions. And there's been some evidence of that for philanthropy. So what that means or what that could look like is having staff that have actually worked in nonprofit organizations, or having decision-making bodies that are representative or reflective of the community that's being served. And so many foundations are moving in that direction.
More questions, please? Yes. Yeah. Why don't we come down front here, please? Yes.
I wanted to ask.
Name and affiliation.
My name is Ruth Lubick. I'm a nurse midwife and an anthropologist. I would ask the panel's opinion about an almost outcome disoriented pattern of giving, which is the MacArthur Fellowship, the so-called Genius Award, and whether that has made any impact on the field of philanthropy.
I'll have the first go at that, since the New York Times calls me about every 10 years to ask what I think, and I always give the same answer, which is that I think it's the stupidest program ever in philanthropy. Now other people can say.
Do you want to, unlike the New York Times, we'll allow you to,
no,
you know.
I mean, it's for Paul's reason, actually, which is to say that except from time to time, they haven't been able to say what the prize rewards. So you can't create an incentive to certain kinds of behaviors unless you make it perfectly clear what kind of behavior it is you wish to reward. That's the first problem. The second problem is that very often nothing succeeds like success, and the awards have gone to people who have already succeeded, so that the prize itself isn't an incentive to those individuals. And for the most part, I think it hasn't been very effective in finding individuals who are otherwise unrecognized and propelling them onward in their careers. And I speak as a former spotter for the MacArthur Foundation. So.
I was told, and I actually don't know if this is the case, that Jerry Wiesner, who is the author of the awards, former president of MIT, and he was on the MacArthur board, had a theory of change, and that it would identify people who otherwise would not be able to make great contributions. And then it seems to me, if you have that this is an example, to go back to my inelegant term of an upstream idea. But when you do work upstream, as anywhere else, but more there than anywhere, you want to actually see whether the theory played out. And it's not, I just don't know whether that has played out. My guess is pretty much like Stan's.
I won't comment directly on the MacArthur Awards, but for a sector that has little, if any, mechanism of external accountability, foundations are really bent on garnering really good PR. And we have this really big desire to get good press and good PR, and I think it, in mostly bad ways, but some good ways, shapes a lot of what we do.
Can I ask a question now that you asked that? I'm delighted to have you both here. Why do you advertise on NPR?
Good question.
We support NPR because we think it's a phenomenal source of news, and when you support it, they give you the opportunity to, we don't say just and verdant society, I can't remember what we say, but they give you that opportunity, and why not seize it? But it's not the advertisement, it's actually the, I think, $600,000 or $700,000 a year that is valuable to us.
That decision's above my pay grade.
The paucity of good winners, the MacArthur Awards, of course, it's an exception. Ruth is an exception to that rule. And for those of you who are interested in that, Martin Wooster has in fact written in Great Philanthropic Mistakes, right? There's a chapter on the MacArthur Awards. Okay, yeah, and that was reprinted in commentary. So there is in fact some discussion of this in other places. More questions, please. Yes, in the back. I'm sorry, and then we'll move up.
Hi, I'm Sue Hochstetter with the Alliance for Justice. Heather spoke about the GEO study, that the funders that are more empathetic, that listen more to who's going to be affected, are doing better, are more effective. And the panel seemed to agree with, democratizing boards and getting more feedback from those affected. However, we discussed this at an earlier event here, and one of the speakers up front said, well, foundations don't have to do that, and it's not going to take off. So there have been baby steps. There are some funders you hear about that actually engage groups in their grant making for input, and do a wide variety of other things to bring in some more community input. But given that we know that there's some effectiveness when funders listen more, and that there's some agreement in this group that that's a good thing, what can we do to make this become more of a practice within the foundation world?
And just reinforcing the question a little bit, the Center for Effective Philanthropy, of course, consistently finds, more or less, that foundations are bad listeners, right, to the grantees. And in spite of the fact that they keep reporting this year after year, right, I'm not sure that the center finds a lot of progress against that. And in fact, in the case of the Gates Foundation, of course, most spectacularly, they have been quite opaque and difficult to figure out by grantors, by their grantees. And Gates consistently says, and we're going to do better next year, and that's sort of a line that appears in every annual letter from Bill Gates, i.e., we're aware that we're not doing well and we're going to do it better next year, but it doesn't seem to change.
I mean, I have power over one foundation for 4 more months, but I mean that describes the field. That is, again, on the whole, I think the lack of formal accountability is good. It doesn't mean it's optimal, but philanthropy, in some sense, is a stronger field because there's more shared information, but it's a very weak field in the sense that there is no leverage other than criticism. That's why I think that Pablo writing op-eds, even if I disagree with them, the National Committee on Responsive Philanthropy, which I had a lively argument with in blogs, I think these are very, very important sources of trying to get foundations to do what people think is the right thing. But you can't make anybody listen. You can just hope that once in a while, no matter how protective a foundation shield is, that enough criticism will get through.
Yeah.
This sort of reminds me of like HR policies where you have your annual performance review and and the expectation that this is a magical time when all the bad stuff about the employee will come out and you wait until then to tell them what a bad job you're doing. If you're waiting for a grantee survey or a performance review to tell you what a bad job you're doing, then something's wrong. Something deeper is wrong at the foundation. And it's not just an accountability issue. That's like a moral, like a common sense issue. And in my experience, and maybe this is unique, even though foundation people walk around with dollar signs, so we're always the best looking and the smartest. Wally Nielsen would always say this, and the funniest people in the room. A lot of people are not shy about telling you that you're not being responsive, you're doing a terrible job, we're going to go somewhere else. Probably not enough. But, and maybe there's room for some foundation to come in, and maybe it's us, maybe it's Hewlett, maybe it's someone. Maybe there's some like arbitrage opportunity there, right? Since most foundations don't listen to their grantees, or we don't think they do, for some foundation to really come in and do like a super job because they're actually doing something other foundations aren't. If foundations acted like rational actors, they would do that. So I think it's not just like an accountability issue. That's like just a common sense, moral issue. You're doing a bad job if that's the feedback you get.
Foundations don't get that feedback. It's interesting, the CEP scale starts at the giant economy size and goes up because even people who are annoyed at foundations, on the whole, they don't walk away.
I'll send my emails to you.
No, I mean, it's I agree with you. I agree with the aspiration. I actually don't think that's what's happening.
Was that a surprise for you, Paul, when you came into this field from law, right, where the discovery of truth is a process of back and forth and defense and prosecution? Was it a surprise to you to see how little of that goes on in philanthropy?
So,
to what do you attribute this relative? I mean, there's a Pablo, there's an NCRP, a few other organizations, and that's about it. I mean,
I have a very clear explanation. I mean, I went from being dean of a law school where faculty and students and alumni told me what I was doing wrong every day to the Hewlett Foundation, and somehow within 2 months, I think I underwent a personal transformational change, and I became almost perfect. And the interesting empirical study, not one for the Poverty Action Lab maybe, since it can't be randomized, is on September 1st, how long it takes me to go back to just being, the jerk I was before.
Yes, please. More, unless someone else on that? No? Okay, good. More questions, please. Yes, I'm sorry. Gentleman right here. Again, speak directly into the microphone, name and affiliation.
Okay, great. I'm Greg O'Neill. I'm director of a think tank on population and aging here in Washington, D.C. There was a question before about a unique type of grant. As a grantee, I've been a benefactor from a unique type of grant maker, limited life foundations. I don't know how many there are in the total sector, but some of the things that were talked about today on the panel through their lens would probably be very different since, for example, there was an example of an 8-year operating grant. Well, these foundations weren't even around for 8 years. They were around 5 years total. So I wondered, how you might frame some of the discussion, or if there had been a person on the panel from a limited life foundation, how that might be considered.
Can I just comment from a scholarly point of view? Just in the last few years, there's been a lot, or not a lot, there's been an increased amount of attention to limited life foundations. And Francie Ostrauer, who's now at the University of Texas, wrote a wonderful piece just a few years ago on it. The Espen Institute commissioned a piece that was published a year or so about it. And because there is a lot more interest in creating limited life foundations now, although the idea it was there at the very beginning of foundations in the early 20th century. So it'll be interesting to see. Certainly there are a lot more now, and I think many more new donors are considering that as an option. The difficulty is that because there haven't been a great many of them, and particularly in recent years, our data isn't very good, and it's a little hard to generalize on them. But there is beginning to be some good scholarship on it.
Bill had, it stands right. There are more and more of them, and usually the one that jumps out to people's heads is the Gates Foundation because they put a large limit on it, but it's effectively a century long. So it's limited life, but it can effectively go on for a century. Bill had Ray Madoff, professor in Boston, I think, maybe last year on a panel, and she wrote a book called Immortality in the Law, and it wasn't directly dealing with philanthropy, but it was more to deal with statutes on the record that really enforce the power of the dead, in her terminology. So she did have a couple chapters dealing with philanthropy and donor intent, and I agreed with very little in her book. However, except for her advocacy for more, limits on perpetuity, I think, that I don't know about any foundations that have 5-year, 8-year. That's really short. But if it was like a 25 or 30-year, that's not perfect accountability, but it's you're getting to something. And we've seen a couple of the foundations that have gone out of business. Most out of business have sunsetted. Most recently, the Olin Foundation. And that's an outlier, but hugely effective in terms of what they were trying to accomplish and sort of their outcomes. So I think it definitely is something. I probably wouldn't go as far as we almost came close in the 60s to like an actual law in the book saying you can only be 40 years or whatever it was, but it's definitely something that there should maybe be more of.
Right. And when the Rockefellers originally wanted to get a congressional charter for what's now the Rockefeller Foundation, and in order to try to, in effect, purchase that from the Congress, they agreed to a 25-year, they were willing to agree to a 25-year limitation. Well, it turned out for political reasons they weren't able to get that. They went to Albany, and they got a perpetuity instead. But if the Congress had been willing to agree at that point, we wouldn't have a Rockefeller Foundation anymore. What's interesting to me in the most recent scholarship, though, is the study of the problems of winding down. And particularly when you look at a very large foundation like, say, Atlantic Philanthropies, which is winding down now, developing a strategy over a relatively short period of time, 10 or 15 years, to spend billions of dollars is not easy, and how to do that in a way with sort of maintaining true to your purposes and faithful to your grantees turns out to be quite tricky.
Yeah, you kind of go from one problem, spending the 5% and not accomplishing much, to having to pour billions of dollars out and just overwhelming people. So yeah, another problem.
Yeah. The subtitle to Ray Madoff's book is The Growing Power of the Dead, which is one of my favorite subtitles. Anyone else on the question of perpetuity? Would it make a difference? We had Professor Olivier Zans has a new book out on philanthropy. We did a panel not too long ago. Has a very interesting chapter in the beginning, the degree to which the first step in the establishment of the modern American large foundations was really severing the foundations from a very specific and time-limited goals and enabling this larger focus on sort of universal goals and in perpetuity. But it was a significant legal event that had to happen before that kind of development in philanthropy could take place. And it's a good question as to whether,
Also, I'll say that if you want to really have trouble falling asleep some night, I wrote an article some years ago on the origins of the capacity to have a perpetuity for these purposes in the United States, and it really is boring.
Yes, please, right here.
I'm Terry Langston. I'm a consultant to the Open Society Foundations. I wonder if Professor Katz has any data and what Paul might have to comment on a tendency that I saw in the career that I had previously in philanthropy, and that Jim Smith has written about, that to be sort of overtaken by lawyers, and not only as the chief people to run the foundation, but even on the program officer level. It hasn't seemed that it's been that any one other discipline has been so prevalent in the professionalization of philanthropy in the last, maybe the last 40 years. Every time I tried to articulate, frankly, the problems I saw with this, I found myself skating on the thin ice, and so it's hard to. But I just wonder if. Is there any, have you seen that tendency? And is it totally a good thing, Paul, to have so very many lawyers involved in this field?
I think we ought to ask Dane. He's a lawyer. Let's ask him what he
Paul was
thinks.
the dean of a law school.
Well, first of all, I'm not sure whether the premises of your question are right. It'd be interesting to look at the top 50 foundations and see how many are run by lawyers or former lawyers. I just doing a quick mental look around kind of an imaginary room, and I'm not sure it's all that many. Personally, I was a lawyer for 2 years in the 60s, and then the rest of my time being a law professor. And I think law professors are more like other professors than they are like lawyers on the whole. But we do have a general counsel, and we have a general counsel in part because, and I've never tried to practice nonprofit law, because of the amendation I made to Stan's point, which is, foundations that are engaged in supporting advocacy need to be very clear about lobbying rules, and foundations supporting work in developing countries need to do a form of grant making that requires much greater scrutiny than giving to a 501c3. So that's why we use lawyers. I could make some, self-serving remark for the profession about how lawyers are good problem solvers, but you would burst into laughter, so I'm not going to try that.
Actually, I'll make just one comment, which I think is not a lawyer but a law teacher. Law is general education for many Americans, and it's not surprising. I think it's a good thing as a law teacher that so many of our most interesting graduates go on to public careers in other fields. Is not a bad form of general education.
No comment, Dane? Is that?
Yeah, yes. Well, I'm biased. I went to law. No, I agree with Paul. I don't have the breadth that Paul does in terms of being able to do a mental scan of the field, but I agree. It doesn't strike me as like a particular problem, and you kind of want them around because of not just advocacy, but all the laws and regulations that foundations have to deal with. We hired a professor from a university last year, and universities aren't exactly, free of a legal thicket, but he's really been greeted rudely with, in the work he does, the amount of things that he has to run into in terms of IRS restrictions. He's not a lawyer. So no, I obviously agree with Stan. It doesn't strike me as a huge issue.
That's interesting, though, because Stan, you were saying that, let me just raise this as an issue. On the one hand, there's a thicket of law, right, that governs philanthropy, and I think you're right about that. But on the other hand, there's an enormous amount of freedom that you were referring to earlier. How does one reconcile
No,
this?
but I don't think there's a contradiction between the two. I mean, a lot of what we're talking about is regulations and that area of law as opposed to underlying norms that govern behavior. And as I say, I think there are very few underlying norms. There are very specific statutory limitations, particularly the political activities limitation, that's for sure. But on the other hand, if we talk about purposes, which is what we're talking about today, there are almost no restrictions as to purpose, and that's really what characterizes the U.S. philanthropic tradition, I'd say.
Right. The exempt organization restrictions, the IRS and even state restrictions, are very narrow. They're deep, and they can be unforgiving, but they're very narrow.
One more question, please. This gentleman this gentleman right here has had his hand up a couple of times.
Stanley Katz, you made the observation about short-term versus long-term and philanthropic goals. I wonder if you could elaborate that. I just came from an event this morning featuring 2 U.S. senators on innovation policy in the United States, and it was about the short-term versus the long-term focus of industry and the need for R&D to encourage a long-term focus. And just to motivate it in the context of philanthropy in Washington, D.C., think tanks are a major recipient of foundation funding, and some people would argue that they all laud themselves for being innovative and whatnot, but often they have very much of a short-term foundation, highly derivative, advocacy-oriented, taking other people's ideas and running rather than really developing intellectual capital, which some would say is what they're supposed to do and what they often claim to do. And is that a problem or not? Just anyway, I don't know what you had in mind when you made that comment. Maybe you could elaborate.
You asked about 6 questions, I think. Let me try to answer 2 of them.
Okay.
One is the historical answer, and that is that I think one of the strongest themes of early philanthropy in this country was what I would call very long-term. So I think that the Carnegie Corporation or the Rockefeller Foundation in the 1920s and on into the 30s even, by and large, aimed at very long time goals. Their purposes were very broad, and they wouldn't meet the test, I think, that strategic philanthropy would like to put to them. We could talk about that separately. But they saw themselves as producing social good down the line, and that didn't bother them at all. And their primary technique for doing that was investing in university research. And they were quite happy, particularly in the sciences, to invest in research that didn't show any immediate, you would think, for instance, of in the 1930s, the Rockefeller Foundation decision to, in effect, to create the field of biochemistry. They didn't know exactly what that was going to produce. It's produced a lot, as it turns out, but they couldn't have told you in 1925 what it was going to produce. So that's the attitude that I'm talking about. As to think tanks, that's a function, I would say, of patterns of funding, in fact. The think tank as we know it exists, again, because Carnegie and Rockefeller foundations were constrained politically from doing what they wanted to do, investing in socioeconomic research, because research is what they did. So they set up in effect, dummy corporations in order to do the research for them. Well, they were called the Brookings Foundation, the National Bureau of Economic Research. And there were places where foundation money could go and do things that were socially and politically necessary, but dangerous at that time for foundations to do. So at that point, they had very long-term agendas, because that's what the foundations wanted. Today, they serve different purposes. They have different masters when it comes to funding. They raise money in very different kinds of ways. Not too surprising that they're interested in the short term, because that's where they get their money.
Yeah. Final remarks from the panel on anything, that question or any earlier questions, or just final? No. Okay.
Thank you.
Very good. Well, let's thank the panel.